Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them for some brief remarks.
Good afternoon, and March 22nd, as a Monday usually, we review what happened over the weekend, besides wonderful spring weather for most people in the province of Ontario. And hopefully everybody enjoyed it safely, outdoor. We'll talk about that in a moment. But we still have numbers and concerns about those as we watch to see how we're doing in this third wave thus far. So with that, I'm going to hand things over to Dr. Yaffe to review our numbers and give us an update in the various sectors there accordingly. So over to you, Dr. Yaffe.
Thanks very much. Good afternoon. Since our last update on Thursday, Ontario is reporting an additional 7,064 cases of COVID-19. That's 1,745 cases on Friday, 1,829 cases on Saturday, 1,791 cases on Sunday, and today, 1,699 cases. Our 7-day average for daily cases is currently 1,600, and that is up from 1,350 last week and 1,155 2 weeks ago. We're also reporting an additional 42 deaths since our last update on Thursday, which includes 3 more today. Today, there are 813 people with COVID-19 in hospital, up 765 yesterday and 699 last Monday. The number of people in ICU today is 298, and that remains unchanged from last Monday. With respect to testing, today we're reporting 31,089 tests completed, with a percent positivity of 5.4%. This is the first time since February 1st that the percent positivity is above 5%. The average percent positivity over the last 7 days is 3.9%, and that is up from 3% for the same time period last week. Today, we're reporting a total of 1,424 confirmed cases of variants of concern in Ontario. Of these, 1,340 are the B117, or first identified in UK variant. 48 are B1351, the variant first identified in South Africa. And 36 are the P1 variant first identified in Brazil. There are an additional 13,226 samples that have a mutation detected where no lineage has been determined. The 7-day rolling average positivity for variants of concern is 46.4%, and that's up from 37.9% 1 week ago. The latest effective reproduction number for the variants of concern is 1.33 as compared to 0.88 for the cases that were not variants of concern. And with that, I'll turn it back over to Dr. Williams. Thank you.
So thank you. So with that, we have had some movements and changes within the framework over the weekend, and some were effective as of midnight on Monday. So that means we've had some regions, 8 in total, were in movement on the framework as of midnight last night. And while some regions had some improvement in the metrics, others had increased concerns in areas of elevation. And so we already had our 5 that are in the gray zone, namely Peel, Toronto, Sudbury and District, Thunder Bay District Health Unit, as well as Lambton. And we continue to watch them, and they're making, at least in a couple of them, steady progress of bringing things down under control, but a lot more work ahead. So we are assisting them in any way we can, especially Thunder Bay and Sudbury and Lambton at this time, and ongoing work and support with Toronto and Peel. As well, we had 3 others that had moved into the red zone over this time, midnight last night. Those were Brant County, Chatham, Kent, and Leeds, Grenville, and Lanark health units. And also they joined Ottawa that had moved into the red zone on Friday. We also had some changes in restaurant capacity issues that were announced over the weekend, including also in the gray zone, some changes there where we said you could have patio or outdoor dining, but there was restrictions there as to the time when you had to close. They're open had to close from 10 p.m. to 5 a.m. in those jurisdictions. Again, with some restrictions and checks and balances, which I'm going to talk about. While we are going in the third wave, and Dr. Yaffe has alluded to that and talked about the growth we're seeing, the percents of the variants are going up. We're moving steadily up to 50% in that, and some day-to-day samples are even higher, but we're working on the 7-day rolling average. Our percent positivity is up. The number of cases that we were for about a week and a half ago, we were around the 1,000 mark. Then we went to about the 1,200 mark, and now we're hovering around the 1,700 mark for the last number of days. And we have a little lowering of the counts over this past weekend, but we'll have to see if we can stay below 2,000 as we go into this week ahead, because the volume of testing is still up. Many people are still acquiring signs and symptoms and coming forward for testing. So this is a challenge to us across the whole sector as we deal with the case contact management. Outbreak controls, we're getting more and more outbreaks, dealing with a number of students that are showing up with one symptom and being identified as positive, and finding more variants of concern and the rapidity at how these move through our communities. We're also concerned about how the variants of concern are presenting to our hospital sector, as they seem to come with presentation of higher levels of ICU admission, and unfortunately, some of the early indicators and some studies consistent with other parts of the world, higher levels compared to the other COVID of higher mortality rates and affecting younger people. So these things give us great cause for concern. This seems at times to some of our scientific people adverse to opening up some activities. And yet they have support to say you can have more outdoor activities, and we're trying to look at what those might be. You can have outdoor dining, as we put in there, but with distancing. And so with these increased access to some activities, as you might hear about, comes increased responsibility personally to make sure that you are doing those things correctly. Because while they're there, they're not without risk. The risk is dependent on how you protect yourself and how you assess the situation of whoever's running a venue or dealing with it. Are they adhering to the rules or are they not adhering to them? Is there the 6-foot distancing? Are households staying at their own tables? Is there proper masking and hand hygiene and other things in effect when you're partaking in these activities? Because I said before, if you do all these stringently, you will not acquire COVID or the VOC. But with the VOCs, especially the variants of concern, you have to be very stringent and careful about that in your activities, or you may choose not to partake in some of them if you have other health conditions or aspects that you want to maintain that protection. So continue to follow the public health measures. Whether you are in the gray, the new reds, or you're in orange, yellow, or green, it still is important at all those levels, because we've seen some of our smaller levels, other ones that have been in green for a while, all of a sudden very quickly, such as Leeds, Grenville, Lanark, go from green just about in the middle of February up to now, well into the red zone in a very short order. And we were hoping and working with them, with Dr. Stewart in the area, to keep those under control and hopefully bring them back down and not have to go into a lockdown type situation. So it takes everybody's effort, individuals, organizations, services, all the ones have to do their aspect in there, as people do want to have access to some of these services that were locked down, as I now feel are essential. But if you want to keep them open, keep being careful, keep being constrained, keep doing everything you need to do in the proper way, and follow all the protocols and public health measures. So, upcoming, ahead of us, we have some more activities. We have Passover coming in this Saturday, and we ask that those individuals partake in that will do all they need to do to protect themselves, their loved ones, and others as they undertake these celebrations, still under time of constraint, that we hope in the future with vaccination we'll have a different world to deal with in the future. But right now we're still in the thick of it. We still have our third wave. Easter is coming as well. That's another long weekend with other people partaking in activities in that time, and needed to be very careful and planning ahead of time how you might undertake to do it in a safe way, honoring the public health measures, protecting yourself, your loved ones, and your family, and still enjoying some of the aspects of these festivities, and of course the honoring those aspects that are part of your religious ceremonies and rites in there. So it's a contrast with some things being allowed to open, with the weather improving, but you can do that with certain protection. Not certain, but definite protection. Do what you need to do to be careful and keep honoring that and to watch that. We'll be advising you of how those are going. We're in the third wave. The numbers are slowly going up. They're not going as fast as predicted by the modelers, and that's to your credit that you're keeping things, keeping yourself, keeping your family and friends under control. But it doesn't mean we're out of that yet. It's still going up. A week ago, we were at about 32%, 33% rolling. We're now at 49%, so we're going up. We're not doubling, but we're going up continually with our variants of concern, and we're now starting to see impacts on our hospital rates. Our ICU admissions are up again. Our hospital admissions are up again, and so that dipped down to where we hoped to get to, we didn't get to, and now it's picking back up again. And we're concerned about how this might, in fact, impact others. And for ones who are younger, under 75 and 80, your concerns are as relevant as those, especially when it comes to variants concern, not only from the acute impacts and the higher levels of hospitalization, ICU admission, and morbidity, but also with the acquiring of some of the long-term effects of the so-called long-hauling syndrome. You have to be careful. It is not a benign issue, and you want to protect yourself. Even when you're at a younger age group where you might think that you're invincible, you need to be careful and not acquire it. So be careful, be steadfast, enjoy the outdoors, enjoy them safely, enjoy them carefully, and with your family and friends, with the right distancing, with the right masking, the right precautions, so we can continue to be healthy as we wait for our vaccines that are coming. More supplies are coming in, more places are opening up, the registration's working well, and we need to be moving stalwartly forward on that as well. So when your turn comes, take advantage of that. Book it. Only book one place. Some people are being less than responsible in booking multiple. I would ask you to discourage that from happening. You will get your time when you're booked. So do it. Do once. If you happen to have two that you made a mistake on, cancel one and stick to one booking to allow someone else to get access when they need to. So with that, I'm going to hand things over to media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
A reminder to press star 1 should you have a question. First, we will go to Shalima Maharaj at Global News. Please go ahead.
Hi there, Doctor. Thank you for taking my question. We asked the Premier earlier on when pharmacies, many of which we've been hearing are without vaccine supply, could expect to see more. And he said that the province has been trying to keep at least 1 to 3 days worth in stock. Is that the case? And why keep that many doses in stock when the need to vaccinate right now is so dire?
So I think the question was more in relation to some of the health units and their supply and how the vaccine rollout sometimes is down a bit on the weekend. Where general flow is that they get their supply deliveries on Monday and Tuesday, and they want to make sure as they finish off the week they have some left, because there are some people coming in with urgent needs and they want to make sure they can cover those, especially to carry them through their booked appointments into the latter part of the weekend, Sunday, and into Monday and Tuesday until they get their next supply, and they can then guarantee a continuation. So they want to make sure that they can, as best as possible, guarantee those booked appointments, especially early in the week. So it's not trying to hold back, it's trying to make sure you can commit to those booked appointments as you have endeavored to do so.
Follow-up?
So I'm not sure I really grasp what you're saying there, because I know you said that, it's about sticking to those booked appointments, but at this stage, really, you can only gain access to this vaccine by booking appointments. So is there really a need to be holding back to begin with, or to be containing a certain amount of stock?
So our appointments are based on categories, and we try to project when we will have that available on our known supplies coming in. And so we are trying to make sure that's as carefully monitored as possible so that we can honor that and ensure we have enough supply to guarantee. Sometimes, as in recently, we get an uptick in some supply. That allows us to move and adjust in that regard. So I'd say my sense in there is that pharmacies will have a variation. They have some people come in and make more appointments, but they want to make sure they can guarantee the supply. And health units want to make sure they can match those in their mass vaccination clinics. So there's some ebbs and flows in that line there. So our direction clearly from the center is that if you have vaccines available, keep putting them in arms as soon as you can. There may be some time they might run out and have to change. We hope that doesn't happen very often, and they're trying to manage that supply chain management term in a timely way, and they will do that according to what their stock and supply is in their individual pharmacies, as they'll get different flows and different capacities in each of their respective jurisdictions.
Last question, unless someone else joins the queue.
Rob Ferguson, Toronto Star. Please go ahead.
Hi, Doctor. I just wanted to circle back on the vaccine thing from the previous question. If they're holding back vaccines, like when you say they're holding back, sometimes there's an emergency. So what would that be? Would that be taking them into a hot spot or something like that, like a factory, a nursing home? Like, are you at that stage yet?
We do at the central one have some that we move and allocate around as quickly as we can to various hotspots, as you alluded to there. Much like we did, we had requests from some of our lockdown zones, as in Thunder Bay and Sudbury, and had to deal with some high-risk populations that the local medical officer of health felt was critical to try and bring those numbers under control. So we'd like to honor those and meet those, as well as there may be some supply chain issues in certain locations that all of a sudden you have to surge up and bring it over to that location to deal with. So it's a big system. There's many people coming on board, more and more pharmacies coming on board. We're hoping to keep the supply moving, and that time we're assuming if someone's promised that you're going to get a delivery on a certain day, it'll come. It doesn't mean it always does come, so you have to allow for that, because you're dealing with ones being shipped from overseas. It gets into our central one in some locations and then moved out to the province and territories. So we like to predict as close as we can, but one can't be too tight on that, because there can be delays for a day or so, and you're going to have to deal with that with internal system flow and supply chain management.
Follow up.
Okay, yes, thank you. And just on the whole appointment booking system, I'm noticing like it seems to be fairly consistent that bookings are lower on the weekends. For example, I think Friday was about 60,000, and then yesterday 31,000 and change shots were given. So is the system taking fewer bookings for the weekend on purpose? Because I'm wondering why it's so divergent, because in many cases you would think that more people would be free and have the spare time to get a shot on the weekend.
Well, it's in the first few weeks of it happening there. I'd like to see how that goes over time and trends. With the booking, I think as far as our task force is concerned, if we could be having large volumes on weekends as the supply would allow, we'd like even bigger every day, going through 6 or 7 days a week. But there's various ways that they're set up. And so you're right, we've seen this trend a couple of weekends. Let's see how it goes forward as we move, especially this coming number of weeks ahead, when we're going to start getting large orders of Pfizer, some more of the AstraZeneca, and we're getting some others of the Moderna coming in. So this has been the end of this very much pause period of the different companies. So we'd like to see that really pick up. We'd like it even more, that we could be moving a lot more than just 50 or 60,000 a day. I'd like to, and I know General Hillier would like to see it even higher, but that depends on what's coming in the other side. So there could be some ups and downs on days. We'd like to see it high every day if we could.
Last question, unless someone else joins the queue.
From Holly Mackenzie Sutter at the Canadian Press. Please go ahead.
Hi, Dr. Williams. Just hoping you can go over in a bit more detail the science that supports expanding indoor dining by so many people. Like 50 people in the red zone is obviously raising some concerns, and I guess just wanted to hear more of the logic behind that.
So the logic behind that is that when we looked at one of the complaints before was that when we had the total of 10 in the red zone, for example, or nothing in the lockdown zone, people said, well, if you're a small place that can only seat about 20 or 30 people, that may be okay. In fact, they can't even put 10 people in that place because the distancing wouldn't even allow that. We had other places that have a huge capacity, can normally seat 300 to 400 people, and they said having 10 in there doesn't make sense. How come we're contained by that? Because we could distance the 6 foot between the tables. We can have all the constraints and issues in there. So we were asked to look at it more from a standpoint of taking a number such as the fire marshal's capacity, which is calculated on a square footage, if you may, and then using a measurement on there to look at how that might work. So as a result, larger centers could maintain the proper distancing. People sit at the tables, they're masking except for when they're eating their dinner or their meal or whatever, and their separate table by table is 6 foot distance, and you can imagine some places have the physical layout to put 50 in a place, some won't. Some may not even be able to put 10 in the place, and that's understood. And then households at that table. So we wanted to be understanding some of the issues where with more checks and balances on the rules around that indoor dining, that some owners said, we can do that, we can guarantee that even with more in the place, but for us to open up, if we normally can seat 300 to 400, having 10 means it's not even worth opening. And so we're trying to understand their perspective and asking them to say, okay, we'll increase that capacity, but we need you to guarantee that you can meet all those standards and make sure the patrons coming in follow all the rules for the protection of them, but as important, for the protection of your staff and following all those aspects there. So it is a agreement to understand their issues, but then they have to understand how we have to be very stringent on the protocols around that.
Follow up, and this is the last question.
Yeah, just wondering though, I mean, the not wearing masks when they're eating is quite a long time of when they would be inside, and I guess that is kind of what makes the logic behind this not only questionable, but also I think people are wondering about the timing of why do it now, days after you declared that we're in a third wave and the variants are so much more prevalent than they were, even a couple months ago.
So in that, we're a strong request to look at some consideration because some had been dealing with some matters there. I was okay to allow this variation to come in if there was checks and balances as in the proper protocols in place and to be persuaded by that. That means people, we call it reservation initially, you have to register when you go in. We need to know your name and address and where you're from because if there's an outbreak, we have to follow that on in a stringent way. And as well, have more inspections by both Public Health as well as Ministry of Labor and to ensure that there's compliance with those programs and services in there in the red zone in that. So we've only made those modifications at this time. And again, if it doesn't hold and the numbers go back up, then it's back into lockdown and there would then be only outdoor dining and no indoor dining. So these are all contingent on the numbers staying down. And as we alluded to at the start, and concerns with some of our science table is that our numbers are growing across the line, and some are doing a very good job at keeping them under control, and some are being less than vigilant in their activities. And we hear again social gatherings, other things in a way. If people went to a indoor place that was carefully monitored, it's better than someone's backyard or in a garage where no one's monitoring anything, and we're seeing outbreaks related to that. And that's very perplexing and concerning because that then spreads to others, especially with the variants of concern, and moves rapidly through the community and results in closures. So there's a balance here between trying to understand people's perplexity at having been lack of those facilities for a long period of time. But like you do with other people, you say, you can open, but you have to honor that. by respecting all the rules and regulations, or it can be lost again pretty quickly again. So it's in a way, an agreement, a contract with the public to say, you really want to have this, you can get it, but you got to follow all the rules very carefully. If you want to be a proprietor of that or an owner, you can deliver it, but you're going to have to honor and keep strictly to all the rules in there if you're going to keep it open. Because there's an outbreak identifies your location, it'll be closed for quite a period of time until that's rectified. So we want to respect that people in Ontario want to be careful. At the same time, our scientists are concerned. Does that mean people will be more irresponsible? I'd like to feel that people could be responsible. And that means you have to remind yourself and others around you that they have to honor what's supposed to be there. Because if it goes down, it compromises that for everybody. And we don't want to go back down to lockdown if we can avoid it. And I don't want to go there, but we're trying to reach a standard of understanding. People want more outdoor, do outdoor activities, but do them carefully. People want to eat on a patio. Make sure it's not a whole crowd around a table. Do what you need to do if you want to keep them open. So we understand that people are tired and want to do that, but we have to hold on a bit longer as we get the vaccines out and rolling. So we're asking you to stay the course. We're meeting you in some ways by opening some things up. It's not without risk. And you may want to assess that as an individual, saying, I'm not sure. I know I would be careful. I'm not sure everybody else is. So you're going to have to weigh that out before you decide to partake in those. It's there if you feel you need to, but do it carefully.
Thanks, everyone.